Good afternoon, everyone. Thank you so much for joining us today for our Supportive Housing Net workshop. My name is Joelle Valem-Schwan. I'm with the Supportive Housing Network of New York. Thank you so much again for coming. Today, our net workshop is connection to opioid use disorder resources, harm reduction tools, and drug supply trends with MATTERS, which is the abbreviation for Medication for Addiction Treatment and Electronic Referrals. We're really, really grateful to be able to bring Matters to our community. It's such an important resource for folks to know about and learn new updates to really understand how to access the Matters referral platform, explore harm reduction initiatives and resources available through Matters, and discuss contaminants and current trends in the evolving drug supply. So, we really, really are grateful for you all for joining us today to learn about this, and grateful to Matters for being here and being an important resource in the community. So with that, I'm just going to pass it along. Please, as folks are doing, though, keep introducing yourselves in the chat. It's great to know who's here. Let's be in community with one another. And then we'll ask you to put your questions in the chat. And at the end of each of Brooke and Mia's presentations, they'll answer questions. And so with that, we have Brooke Langella, who's the outreach coordinator at Matters, and Mia Dickinson, harm reduction coordinator at Matters. And I will pass it off to you two now. Thank you.
Thank you. Good afternoon, everybody. My name is Brooke Langella. I am the Long Island and New York City outreach coordinator here at the Matters Network. So the purpose of my role is to really build and maintain strong relationships with different stakeholders throughout the community to, one, help strengthen the Matters platform, and then two, to help reduce barriers that individuals in our area who are struggling with opioid use disorder face, especially when seeking treatment. I do have a presentation that I'm going to go through now. If anyone has any questions about any part of the platform, please feel free to place them into the chat and I will review them at the end. All right. First and foremost, just a little history on Matters. Matters was founded in 2016 by emergency medicine physician Dr. Joshua Lynch up in the Buffalo area. He discovered that the linkage to care was difficult for individuals who were coming through his emergency room multiple times and not leaving with a proper connection to care. Dr. Lynch formed Matters by asking 3 local treatment agencies up in the Buffalo area if they would set aside appointment times to see patients for rapid referrals from the emergency room. That has now grown to over 250 referral partners, over 300 treatment partners, and we have even launched our services across state lines this year as well. When starting Matters, some of the traditional barriers to treatment that were repeatedly noted was the stigma surrounding individuals who struggle with substance use or mental health disorders, the access or lack of access to treatment and prescriptions, and then other barriers such as how will I cover the cost of my medication and how will I get reliable transportation to and from my treatment appointments. In response to this, and in partnership with University of Buffalo's medical division, Dr. Lynch formed Matters. So at the heart of what we do is that linkage to care. Matters is a rapid referral platform that's used to link individuals with opioid use disorder to outpatient MAT programs all across New York State. We support patient success through various resources, including harm reduction, medication vouchers, transportation vouchers, telemedicine evaluations, and follow-up services, each of which we will break down a little further. First, I just want to preface that Matters is made available at no cost to individuals and organizations, thanks to various partnerships that we have formed over the years, some of whom are shown here on this slide. This is a map just to give you an idea of where we currently operate throughout New York State. The map is constantly growing as we continue to expand throughout New York and into neighboring states this year as well. So if you want to see any live partners on our website, if you want to see any live partners in your area, you can visit our website, mattersnetwork.org, and just scroll down to the bottom of the page and you can see all of the different partners in your area. This next map highlights an important relationship that we have with law enforcement and corrections. So as some of you may know, during periods of incarceration, your Medicaid coverage is suspended and may not be reinstated immediately upon reentry. The Matters medication voucher can be utilized here to ensure no out-of-pocket costs happen for the individual while they're waiting for their Medicaid coverage to be turned back on. There are 2 ways to access our services. One is by visiting our website, mattersnetwork.org. You can highlight over the different options, so you can be connected to a local outpatient treatment organization and or connect to the virtual emergency room, all of which we'll go over shortly. You can order some of our free harm reduction supplies. You can learn more by exploring our educational materials. And then all of these services that are on our website are also mirrored here on our app. I know a lot of organizations, especially in New York City, have some really great outreach teams that go out into the community to help get individuals connected to resources. And this app can be downloaded from the App Store or on Google Play for you to be able to make referrals from anywhere. So how does it work? When our referral site partners from one of these areas on the right, so that can be community organizations, hospitals, law enforcement, EMS, housing agencies, referrals can really come from anywhere. When they encounter an individual who is struggling with opioid use disorder, they will utilize the Matters platform to facilitate a rapid referral. It only takes about 2 to 3 minutes to put a referral through, and then the individual gets access to the medication vouchers, transportation vouchers, a connection to peer support, all with the overall goal of getting that individual to that first treatment appointment. Individuals will be connected to an outpatient treatment organization of their choosing, and they can be seen in as little as 24 hours from their referral. Again, individuals have the option to connect to a peer in recovery for support, so someone who has lived shared experiences as them, who can walk them through providing guidance based on their own lived experience. Just to break down our vouchers program, so the Matters medication voucher is accepted at these major chain pharmacies. It covers up to 14 days of any combination formulation of buprenorphine/naloxone for individuals who are uninsured or underinsured. At the end of those 14 days, for individuals who are waiting for their Medicaid coverage to be turned back on, or for those who are never covered by Medicaid to begin with, they can utilize this voucher in the meantime. And then at the end of those 14 days, if they still are not able to be connected to Medicaid or health insurance for whatever reason that may be, we can connect them to the New York State Department of Health and OASIS BUP app program. So this program covers the cost of the Suboxone prescription for individuals for 1 full year. So Matters has the short-term solution and the long-term solution for Medicaid coverage, for medication coverage as well. Individuals will connect with the Matters staff members. It takes about 10 minutes or so to get someone connected to this program. It's all done over the phone, and then coverage starts pretty much immediately upon approval, and then they can go pick up their medication from the pharmacy. Matters also offers a transportation voucher program done solely through Uber Health. So each referral that is made through the Matters platform, they are offered a free and private Uber ride to and from their first outpatient appointment, as well as to and from the pharmacy to pick up their first round of medication. Individuals will call the Matters team members, and we will get them scheduled for that free and private Uber ride. Matters partners with providers to offer virtual evaluations for individuals across New York State. This is available in our region from 11 a.m. to 11 p.m., 7 days a week. So this is to alleviate the need for individuals to have to go to the physical emergency room, be waiting there for 3, 4, 5 hours, and only be given a 1 or 2 day script and be right back there the next day. These providers are all emergency room doctors that are trained in addiction medicine. They can induct someone on the buprenorphine, and then they will refer them to a local outpatient provider to continue that care. These providers will write the script for 14 days. If at the end of that 14 days, the individual is not successfully connected to a treatment partner for whatever reason, they can go back through and get another 14-day bridge script from these doctors as well. And then lastly, Matters offers follow-up services. So for every individual who comes through the Matters platform, the Matters team members will contact the patient at that 24 to 72 hour mark. That is to assess if the individual has been successfully connected to care, help address any other barriers, such as scheduling them for that transportation or getting them connected to that BUP app program to cover their medication cost. Afterwards, we will reconnect with the patient at that 30, 60, 90-day mark to assess continuation of care. We do have individuals who will drop off from treatment during this time, and we're able to get them reconnected if they're interested. If not, they always have us as a tool to be able to call back and support. So I'm going to stop sharing for a moment. I'm just going to see if there's any questions in the chat. If anyone has any, you can place them now before I pass it over to Mia. I'll just give it a second. While we're waiting, I'm going to put my contact information in the chat. If any of these programs, yes, I will definitely provide the slides to you to be able to share with your team members. If any of these programs you have any interest in at all, please feel free to follow up with me, and we could talk about kind of next steps in terms of partnership. Again, there's no charge to partner with Matters, but that is my contact information there. If there's no questions now, Mia, I'll pass it over to you.
Sounds good. I'm going to share my screen quickly. Mm. And then again, I will also make these slides available. And if you have any questions while I'm presenting, feel free to pop them in the chat. I will go through them after. But I'm going to talk a little bit about harm reduction as well as some emerging substances that we're seeing in the drug supply right now. Some of this harm reduction information might be a little bit of a refresher for a lot of you. But I am going to go over it just in case it is new to anybody. So, harm reduction is really a public health strategy that we use in order to keep people safe when they are doing anything that might have potential risks or consequences. So, when we think about this with substance use or substance use disorder, we really look at substance use as this kind of spectrum that you'll see at the top here. So, only 25% of people who actually use illicit substances develop substance use disorder or meet that criteria as defined in the DSM. So people can really range anywhere from experimental, social, or recreational use down to more regular use, maybe chaotic use, and then substance use disorder. So we don't really look at it as this kind of you don't use anything at all or you have substance use disorder. We really make sure we look at this as a spectrum of folks, and they can fall anywhere on that. So harm reduction can be anything like using Narcan or having naloxone on hand in case of an overdose. It can be things like drug testing strips. But harm reduction can also be used in many other ways. It's not just for substance use. It can be anything like seat belts when you're driving a car, sunscreen when you're going out in the sun. Um, we recognize that it's not realistic to say, okay, driving a car can be dangerous. You might get in a car accident, you could get injured. We're going to ban driving cars. We know that's not realistic. People aren't going to do that. So we implement harm reduction strategies in order to mitigate some of the risks that could be, associated with that behavior. So things like seatbelts and airbags. Same thing goes for substance use. So the current harm reduction strategies that we implement through Matters right now we do fentanyl and xylazine test strips. We'll talk about what those are in a little bit. We have naloxone trainings and distribution. We'll train anybody in the state on how to use naloxone, and we will distribute it to individuals across the state via mail. We have community-based vending machines, so you can see down there in the left-hand corner, the fentanyl, xylazine test strips, and the naloxone also live in these vending machines for anybody to go up to 24/7. They're available outside and access these supplies for free. Just kind of another way that we're able to get those supplies out into the community. We have our mail-based syringe service program. So basically, we provide syringes as well as a couple other, just things to keep safe while injecting. To anybody in New York State, they're able to order via mail up to one time a month, and we provide them with 200 syringes, sharps disposal containers, clean cookers, cottons, that kind of thing. Another one of our services that isn't listed here is our naloxone wall boxes. Right now, we are distributing Nalox boxes through to any organization in New York State. You're able to fill out a form on our website to order them, and we will ship them right to you free of charge, of course. And we will also send Narcan to stock it with if you are not an OOPP. And those are just wall mounted. We also have a community advisory committee that we are trying to get kind of started up and rolling right now, where we basically are looking for feedback and to really just kind of form a relationship and connections with the community and the people that we're serving. So basically, we pay people once a quarter to sit in on these meetings with us, give us feedback, form those connections with people. So that's kind of the harm reduction wing of Matters. So, I'm going to get a little bit into some emerging substances that we're seeing in the drug supply right now. Just as a refresher, opioids, natural or synthetic substances that act on the brain, used in medical settings to treat chronic or severe pain. However, when used illicitly, we don't really know how concentrated they are. If they're produced illicitly, we don't know, what dose you're getting, and they can be extremely addictive and cause respiratory depression, which is what an overdose is when somebody stops breathing or is having a lot of difficulty breathing from that. So fentanyl, I'm sure everybody is aware of, is a really potent synthetic opioid. It's commonly mixed into heroin and other drugs. Um, at this point in the drug supply, we're not really seeing any pure heroin anymore. It's usually a mix of fentanyl, heroin, maybe some other chemicals or drugs that's referred to as dope. So fentanyl is really common right now. It can be mixed into cocaine, methamphetamine, pressed pills as well. So drugs that are not opioids, whether it's cross-contamination or intentional kind of mixing of those drugs. And this is why we have those fentanyl test strips so that folks are able to test their substances, see what's going on, and make informed decisions based on that. Fentanyl, when used in medical settings, however, is extremely safe. There's a lot of safety precautions in place. It can be administered in a variety of ways, whether it's intranasally or via that patch. Transdermally, it has less side effects than other opioids that are administered in medical settings. So it is really frequently the preferred pain medication that folks are using. However, again, illicit fentanyl, we don't know how concentrated it is. There's something called the chocolate chip cookie effect, where if maybe a pill is being pressed, fentanyl can kind of clump together and be unevenly dispersed throughout that pill or a powder, anything like that. And so when folks are testing a substance for fentanyl, it's important to test before each use, because maybe you'll test a part of that pill, half of a pill, and it'll come back negative, and the other half will be positive. So this is kind of why we're seeing so many unintentional overdoses with that chocolate chip cookie effect, and then just how potent fentanyl is as an opioid. A couple quick facts on fentanyl. Um, 88% of our opioid overdose deaths that we see nationwide involved fentanyl in 2021. That number was 92% in New York State. So again, pure heroin is extremely rare at this point. Usually, it's fentanyl, maybe a little bit of heroin mixed with some other things. Um, in Erie County, 65% of our opioid overdose deaths in 2024 involved cocaine. I just have Erie County here because that's where our Matters office is based. But the number can be pretty similar across New York State. The point is that folks either are taking cocaine and opioids simultaneously, and are maybe overdosing, or they are unintentionally taking opioids when they believe they're taking cocaine due to that cross-contamination. So just another reason we're really pushing these test strips out there and encouraging folks to test their substances before they use them. So that's fentanyl. Xylazine is another contaminant in the drug supply right now. It's actually not an opioid. It is a veterinary sedative. So it's also called tranq. It's mixed with, usually it's mixed into dope, drugs like fentanyl, that kind of thing. And this is because the drug supply use for opioids mainly used to be heroin, which maybe had a euphoric effect of this long. When fentanyl is mixed in with that, really shortens that euphoric effect down. So when xylazine is mixed into that cocktail, it really lengthens it out again. So xylazine, basically it's mixed into dope because it lengthens the euphoric effect. It's really cheap and pretty easy to get for folks, diverting it from farms or veterinary clinics or just purchasing it online since it is FDA approved for veterinary use. Um, the issue is, again, it's not an opioid, so alone it doesn't respond to naloxone. It also further lowers blood pressure and respiration, so it can result in loss of consciousness for hours. It really has a sedating effect on folks, which a lot of the times can put people maybe who are using out in public at risk for theft and that kind of thing. Um, And it increases that risk of overdose because it does lower that respiration along with the fentanyl. So again, it's not an opioid. It doesn't respond to naloxone. However, it's not typically used on its own. It's usually mixed in with an opioid like fentanyl. So if you think somebody might be overdosing on something like xylazine, you're still going to want to use Narcan. It is, excuse me. Another issue that we're seeing is that xylazine causes these pretty severe skin wounds. If left untreated, they are commonly leading to amputation. I am going to show a quick photo so you can look away if you get squeamish with that kind of thing. So this is a person who is being treated over the course of 2 years for xylazine-related skin wounds. As you can see, even with pretty consistent treatment over the course of 2 years, the wound still didn't fully heal. And we're really seeing this as an issue for folks with less access to hygiene supplies. Maybe they don't have regular access to showers and things like wound care. So this is another issue with xylazine right now. So xylazine is definitely an issue nationwide now. It primarily started in the Philadelphia, Camden, New Jersey area and slowly spread out to the Western US. In Erie County here in Buffalo, 13 of our opioid overdose deaths in 2023 involved xylazine. So that's xylazine. It's our second drug that we have the test strips available for, so people are able to test their dope for xylazine. Ooh, excuse me. All right, so medetomidine. This is the last one I'm going to get into. It is another drug that we're seeing more frequently lately. It's an alpha-2 adrenoreceptor agonist. So basically, it's a sedative. It's kind of in the same drug class as xylazine. However, it's much stronger than xylazine. What it is, it's a mixture of dexmedetomidine, which is what's used in medical settings, and levomedetomidine, with dexmedetomidine being kind of that active component. When that's used in medical settings, it's usually administered to patients in surgical and ICU settings for sedation, can be used for anxiety relief, pain management. It is also used in for veterinary use as well. The effects that it can have when taken, especially not under the supervision of a medical provider, it can dramatically slow your heart rate. It also causes initial hypertension followed by kind of a prolonged period of hypotension, so it really lowers your blood pressure. It also reduces any cardiac output, so your heart rate slows. Your further respiratory depression, which is also seen in opioids and xylazine. So this is kind of a really bad mix for respiratory depression, which is what an overdose is. Some of the side effects of this can be dry mouth, hypothermia, muscle contractions, respiratory depression. So we really want to start getting people the test strips to test for this. We're working on that right now. They're not available at the moment. But we're seeing more and more people kind of reporting this in the drug supply at the moment. Although it's not an opioid, again, it is usually mixed into opioids, so the recommended treatment is to always administer naloxone. If you suspect that somebody is overdosing and maybe medetomidine is related, rescue breathing is incredibly important due to the respiratory depression. So, you give your dose of Narcan. While you're waiting for that dose to kick in, it's really important to do rescue breathing if you're able to. It also has those cardiovascular effects. So cardiovascular support might be needed in the event of a medetomidine involved overdose. So chest compression, CPR, that kind of thing. Um, that is kind of my spiel for the contaminants that we're seeing the most and hearing about the most in the drug supply right now. I am going to stop sharing this and check for any questions in the chat. Let's see. Is xylazine the drug that was a skin eating drug? So that's sometimes in the media we are seeing reports of mostly in like kind of Kensington, which is in the Philadelphia area, people with these like flesh-eating skin wounds. It's not they're not actually flesh-eating like medically. They it's we're not totally sure of the mechanism as to, why this is happening when people are either smoking or injecting or, using xylazine in some sort of way. Um, but basically, the skin wounds kind of pop up. They are difficult to treat. They can, if untreated, be like kind of necrotizing and the skin around the wounds can start to die, but they're not like flesh eating in that kind of way. And I think that was the only. Yep, that was the only question I see in the chat right now. I am going to put my email in here. So if anybody has any questions moving forward, they're able to reach out to Brooke or me. Yeah, that's about it for us today.
Well, that was very informative and very succinct. You all are very efficient. Is there anything, I just want to give it, if anyone has any questions, want to just give it one more minute if people are processing the information. So I'll just give it one more minute, but want to just say a huge thank you to both of you. This is really informative. It's also just a great resource then to have like your slides, I think, to be able to reference to people
Yep.
are now aware of what you all have and have this education and can reach out to you. So we will be sending this information via slides, their contact information, a video, the recording, sorry, out to registrants. But I do
Yeah,
see
sounds good.
there was a question now.
Yeah, I recently encountered someone that overdosed on crack cocaine and fentanyl was found in their system. Do you provide smoking kits or resources where to get them? So, we aren't able to provide smoking kits right now because in New York State, it's not legal to mail them anywhere. So you would have to go to probably like a syringe service program or something that might have them in person. Um, I think if you're located in like New York City, I would imagine like On Point would have them. I don't know if Brooke or you guys know any local resources to that area.
In New York City, I would have thought also of On Point, but
Yeah.
Tanisha, do you want to put in the chat where you're from or what? And we can put On Point in the chat.
Yeah, the safe smoking kits are definitely something I think a lot of people in New York State are working on providing right now.
Okay, that's good to know.
Yeah, so
Oh,
hopefully
try
we
On
get.
Point. Okay.
Tanisha, if you want, I popped my email in the chat. If you want to send me an email, I could send a message to some of my other partners in the area and see if anybody has any resources that could help you.
We'll look into it as well. I know that there's some people that put together within our membership who put together their own kits.
Mhm.
But I know that not everyone has the capacity to do that. But not seeing emails. Let's see here.
I wonder if we can pin the emails.
Yeah, we'll also email the emails. Um, yeah. Do you want to put your email? Oh, hello, I did not see the emails. Are you guys putting them to, oh, you might just be sending them to host and panelists. Make sure you're sending them to
Oh, gotcha.
everyone.
Yep, that
Yeah,
was the issue.
sorry. Okay.
So, okay.
Okay. Great. All right, there it goes. All right.
I
Well, with
just
that,
want to,
we're,
sorry,
oh, what?
I just want to pause for a second. I just see another question in the Q&A portion. Is this initiative for both substance use and mental health disorders, but primarily focused on substance use? Right now, Matters is primarily for opioid use disorder. That doesn't mean that individuals who have co-occurring disorders on top of opioid use disorder, they can still utilize the platform as well. We are hoping to expand to include referrals for other co-occurring disorders, but right now it is just for opioid use disorder.
Great question. Thank you. Okay. Well, I think are there questions in the Q&A?
I think we've got
I
those.
got them. Okay, great. Yeah, I think we got those covered. Okay, well, we can let folks go. Yes, we're gonna send out the slides. We're gonna send out the email contact information, and we're gonna send out the recording. So stay tuned. We'll send that out to you all. Thank you everyone for attending. This was a great turnout. We had 105 folks on. Brooke, Mia, thank you, thank you, thank you. And to our members, I'm gonna put my email in the chat. If there's other types um of programming like this or resources you'd like to see our net workshops on, please email me and let me know. We're want to be responsive to our members, and we want to be bringing resources that you are interested in and needing. We've heard a need for a resource like Matters, so but would love to hear from you on other things that you'd like to hear about. So with that, I will let us go. You'll hear from us, and we'll be in touch. Thank you so
Thank
much,
you.
everybody.
Thanks for having us.
Bye.